So, with no further ado, I'm going to turn the stage over to my amazing colleague, Dr. Strong. Jen works with us here and sees all of our patients and helps our patients out when they're struggling. She's got an amazing background in naturopathic medicine and likes to subspecialize in fertility as much as possible. So she's going to chat about all these vitamins and what's good and bad about each one. So I'll let you take it away.
Great, thank you. So guys, I thought this would be really cool if we could make it interactive. So if you wanted to go grab your prenatals at home, I'm sure most have a prenatal at home right now. So go grab that and we'll take a look at your label as we're going through these ones as well. And then you can ask some questions that way. So I thought this would be a good topic because usually when patients come in to see me, they're already taking a prenatal, and one of the main questions is always, is my prenatal okay? So I don't really have an absolute favorite of prenatals. It usually depends on what's going on with each person. I do have one that I often use, and you'll be able to figure that out in a little bit. But a lot of the ingredients in there, we usually look at what's going on and what you need lots of, and then we look at which prenatal has what you need the most. Okay, so we're just going to go through the ingredient list. So we'll start off at the top. So most of them start with vitamin A or beta carotene. So with most of these, they're all very similar. Your Kirkland and Materna and Pregvit have similar amounts. Your prenatal SAP actually doesn't have any, so that one's a really good choice for those who are smoking or just have an adequate amount in their diets. And then the Progestia is quite high in vitamin A. Am I looking at the camera?
Look at the camera.
Okay,
yeah.
Sorry. Yeah. So the Progestia has quite a bit of vitamin A in it. So if there's absolutely none in your diet, then that one's a good one to go with. Vitamin A is found in foods. Pretty much any food that is orange has a lot of vitamin A in it. So your pumpkin, sweet potato, carrots, orange melon or cantaloupe. My kids call it orange melon. But otherwise, it's not a huge concern with pregnancy. There's not a huge amount of benefit in taking a lot of it, and it's actually not a good idea to take a lot of it because it can cause some harm.
Yeah, so if you have over 10,000 units per day of vitamin A, it can be harmful to the fetus in terms of causing teratogenesis, which is when the fetus can become it can become morphologically abnormal, meaning you can actually cause abnormalities in what the baby looks like, and they can be quite drastic. So you want to stay under 10,000. All of these obviously do stay under 10,000, but the Progestia has a relatively high level. We said 5,000 in that one. I will throw in there, just from the obstetrical standpoint, that the fact that this doesn't have vitamin A is excellent if you're a smoker, but by no means does that mean that you can go ahead and smoke and then use this. We want you to not smoke because literally every single risk of pregnancy is increased when you're a smoker. So avoid smoking like the plague, please.
All right, so moving on to the next one. Vitamin C is usually the next on the list. So with vitamin C, especially right now, there's always the need for vitamin C during cold and flu season and obviously during the pandemic. High amounts are great. You won't find a high amount of vitamin C in your prenatal because the need doesn't go up that much during pregnancy, although it's still really important. So there isn't a whole lot of difference between the prenatals, although I will say Progestia doesn't have any, but the rest of them have a good amount. So ideally you'll want to, if there's a concern, you'll want to supplement more with vitamin C. Foods that have a lot of vitamin C, obviously your fruits are really high in them. And then a lot of foods are fortified with it, like your Vector cereal and others.
Orange juice and so on. Yeah. So what would you normally recommend to someone who wants to just stay healthy? How much would you recommend? How
much vitamin C?
Yeah.
Yeah, so 2,000. So in divided doses, you could do like 500 4 times a day during cold and flu season, and it won't usually cause a problem.
Okay.
Bowel tolerance is usually how you know you get enough vitamin C, but no one really wants to go to that. So usually about 1,000 to 2,000 on top of like your dietary amount is a good amount to help with cold and flu prevention.
So these really aren't even close, are they?
No.
This one's got 58. This one's got 120. The Pregvit.
Yeah. So your RDA is only 60. So
Oh, really?
you won't find much in
any of these.
a prenatal or a multivitamin.
So RDA, for those of you that don't know what is, your recommended daily allowance. So that's what they recommend that we use. So these are, I guess, close to the RDA, but nowhere close to what you would recommend. So should patients supplement on top of this? Would you recommend, or is this good enough, you think?
So, like for fertility purposes?
Yeah,
so
or
increasing
pregnancy.
vitamin C helps regulate progesterone levels a little bit. I think it helps with, although men wouldn't take a prenatal, but helps with sperm production.
Yeah, anything antioxidant is good for sperm.
Yeah.
So
Yeah, so I guess it just depends what for, but there's usually always a reason to take vitamin C.
Okay, perfect.
So vitamin D is next. With vitamin D, 400 is the recommended amount. Over 1,000, interestingly, is considered a drug, so you won't find more than 1,000 in any supplements. But vitamin D is really good for improving fertility and improving cold and flu prevention. So right now, it's a good time to take that. In terms of these, so they're all pretty similar with vitamin D. If you take the recommended amount, they're around 1,000. Your Pregvit and your Kirkland one's a little bit less.
How much is in Pregvit?
Pregvit is 600, and Kirkland prenatal is 400.
Okay.
Materna is 600, and Progestia is 1,000.
And this fancy NFH stuff?
That one, so the other thing to mention is this one is 3 a day, 1 a day, 2 a day, 1 a day, 1 a day. So if you take the recommended amount, that's 1,000 a day.
This one is?
Yeah.
Okay,
At
yeah, it
3 a
says
day.
333 international units. Yeah. So, okay, so they're roughly close to each other,
Similar,
except for the Materna and the Kirkland brand. Okay. Yep.
And then, so vitamin E is next on your label. So vitamin E typically it's about the same in all of them, except Materna's really low. It's only at 7. The rest are between 30 and 50. With vitamin E, in terms of fertility, it's helpful for improving the endometrial lining. It's another antioxidant, so there's always a need for antioxidants.
Yeah. In men and women, so we use them for both. Yep.
Yeah, and then with pregnancy, the need for vitamin E doesn't go up. Dietary-wise, you get vitamin E from your nuts and seeds, whole grains.
Okay.
Vitamin K is next. So vitamin K is only found in the prenatal. So the interesting thing about
You mean this one?
Yeah, sorry,
Okay,
NFH
yeah.
prenatal.
Yeah.
Yeah, so there isn't any vitamin K found in the other ones. Vitamin K does thicken the blood a little bit, so oftentimes it's not recommended for those going through fertility purposes because of all the blood thinners they're on. But with the vitamin K that's in the prenatal SAP, it's plant-based, so absorption rates are really low, and the amount's really small.
Okay.
So no need for vitamin K in your prenatal. And then we get into the Bs. So B vitamins, they're going to be quite low in a lot of these, like around anywhere from 1 to 3 milligrams. The NFH one, it's quite a bit higher. The purpose of vitamin B, all of them really, they're used as cofactors in a lot of different pathways in the body. So if levels get low, it's kind of like the Chrysler production line. If one person's missing, then the pathways don't work properly. Each one has like a little bit of a different benefit. In terms of pregnancy, folic acid, so that's a B vitamin, that one, the need is higher, but the rest of them, the need isn't much higher. So folic acid. Folic acid, so there's 2 forms of folic acid. The regular type of folic acid is found in these
Private, yep.
three. And then your NFH
And this
prenatal.
This is folic
That's folic
acid
acid,
also.
yeah.
Yeah, so these four have just folic acid, and then this one?
Yeah, so that one has the methylfolate form. So methylfolate is helpful for those who have the genetic defect, meaning they don't metabolize folic acid very well. So methylfolate is metabolized a little bit differently, so you absorb a lot more of it. It's a little tricky to test for, so I often just recommend for those who have been trying for a long time or have an undiagnosed reason for infertility to just switch to the methylfolate form, so that way it rules out that problem. Otherwise, yeah, these ones all just have the regular folic acid form.
So that's the MTHFR gene mutation that some of you may have heard about, or methyl tetrahydrofolate reductase enzyme deficiency. So this is what you use if that exists for you, and we can test for it, although it is difficult and you have to pay for the test. These ones would not help you if you've got that issue, so there is that element to it.
Yeah, and with folic acid, the need is more to prevent deficiency that could cause neural tube defects. So I believe 400 is like the recommended
Minimum 400,
Yeah.
4 milligrams if you've had an actual problem in the past, like a baby with a neural tube defect, so spinal cord problem, any kind of brain development problem, anencephaly, those kinds of things.
Okay. And then B12, so cyanocobalamin or B12 levels are needed about in the same amount during pregnancy as not being pregnant. Just like folic acid, there's the two different forms, so if there's a concern with metabolizing it, then the methyl form is better than the cyano form. And then we get into the minerals. So the main nutrients that are more needed in higher amounts during pregnancy would be your calcium and your folate. So calcium needs increase a little bit. They're all pretty much similar between these five, but the form is different. So progestia, I don't believe has any, so no calcium here.
No calcium?
Nope, no calcium there. These ones have calcium, it's calcium carbonate. So I usually tell my patients if there's no concerns with metabolism, like no Crohn's, colitis, diverticulitis, IBS, any digestive issues, then don't stress about it. Any type of calcium would be fine. If you struggle with digestion in some way, then use a form that's a little easier to digest. So prenatal SEP has the calcium citrate, which is a little easier to digest. The amount's lower, but you absorb more of it. And then iron. So similar situation with iron. So if you have a hard time absorbing iron, then you can switch to an easier form. So Materna, let's see. Materna, Kirkland, and Pregvit have the fumarate form, and that's often why a lot of women get constipated with taking prenatal vitamins. It's just it doesn't absorb well, so it sits in your gut and causes constipation. And progestia has the fumarate form too. Prenatal NFH has the glycinate form, so it allows for easier digestion, so it doesn't sit so much in the gut. You absorb more of it, and constipation usually isn't an issue.
And there is recent data that your iron level going into conception is important for your success, so it is important to make sure that you have an adequate iron level before you get pregnant. It's also very important during pregnancy, because your baby starts to suck a lot of iron out of you in the attempt to build its own blood volume. So frequently, I'd say a fairly high percentage now of women, excuse me, by the time they get to 28 weeks actually have iron deficiency, and we do need to supplement them with additional iron even when they're faithful to their iron-based prenatal vitamins. So there's frequently supplementation that needs to occur on top of what you're already taking. And for those, we always use the glycosylated forms like what's in prenatal SAP because they're so much easier to tolerate. And at that point, we're giving them quite a bit. It's 150 milligrams in the elemental pills.
Is that the Ferromax?
Ferromax, Palifer, Triferex, and Eurofer. They're the four that can be used. I like Ferromax, but they're all the same basically.
Okay, so iodine's next on the list. You may or may not find iodine in your prenatal. Some have it, some don't. These ones all do, and they're all in about similar amounts. Progestia does have quite a bit more. Progestia's got about 1,000. The rest are between 150 and about 220. So iodine's nice for those with if thyroid concerns are a problem, but the tricky thing is with iodine is if a deficiency of iodine can cause hypo or hyperthyroidism. So it's a little tricky knowing who benefits and who doesn't from that one. Okay, so then we get into magnesium. So with magnesium, they're all pretty similar. Progestia doesn't have any, but the rest of them have all similar amounts of magnesium. Magnesium's nice because it's a muscle relaxant. So with pregnancy for leg cramps, if there's a deficiency in magnesium, replacing the deficiency helps with the leg cramps. Helps with some bowel function as well. And then zinc. So zinc is similar across the board. Materna's only got 2.4, and zinc's and the rest are more in the 15 to 25. So if your need for zinc is higher, just check what your prenatal has. If it's not enough, it's really easy to add that in on the side. You can buy zinc on its own at about like 15 milligrams.
Maybe just the highlights of the other ones. What else is really drastically different between them?
Yeah, that's actually pretty much it. The rest are all very similar. Like your prenatal SAP is going to have a little bit of everything, whereas these ones, that's it. That's pretty much all that's.
So this is a bit more of a complete vitamin for nutrients and the basics than the other ones are.
Yeah.
So can you tell us a little bit about the cost differences between these?
Yep. So
in Canadian dollars?
I don't know if does it change with pharmacy? I just know like the prices at
it might change a little,
here.
but they're probably reflective of most
so
places.
Prenatal SAP, so that one per day, so if you were to do 3 a day, it's 85 cents a day. Pregvit, so is that one covered?
Pregvit's often covered,
Okay.
so you need a prescription for this because of the amount of folic acid it contains, but because you're giving a prescription, it is frequently covered.
Okay, yeah, because if it's not covered, it's $1.33 a day, but if it's covered, it's covered.
So this is about $1 a day. Oh, sorry, almost $1,
85
85 cents.
Yeah, and
$1.33.
Yeah, and the rest, like Kirkland is 6 cents a day. So
6 cents a day?
You can't compete with that. It's
Wow.
1 a day. Yeah. Materna's 22 cents and Progestia's 41.
So in order of pricing, it's like that.
Yes.
Okay, so your Pregvit is your most expensive.
If
Your
it's not covered.
NFH prenatal SAP is next. Progestia third, Materna, and then you can't really compete with something that's 6 cents a
Yeah.
day. So you know, cost can be a factor.
Yep.
Yeah.
So I usually say if someone comes in with this and they're in stellar health and they have no health concerns that they want to work on, and they really just need the folic acid, then it's fine.
Sure.
Right?
And what do you recommend to the moms that can't tolerate any of these? They take it and they are too queasy.
Okay, so the one we're missing today is the Smarty Pants. So there's a gummy. So the label says you have to take 6 a day, but the gummy at 6 a day has the right amount of folic acid in it and then a few other nutrients. So that's an option. And then we usually try to figure out why though. So, you know, you can take it before bed maybe and sleep it off, or take it with food, or sometimes the smell. Like I know sometimes women don't like this one. It's got a lot of B vitamins in it, so it has like a bit of a smell to
stronger,
it. Yeah, so I usually just say keep it in the fridge, and that'll keep the smell down. Yeah, the gummies, I guess.
And I actually tell them to take Flintstones because no one ever wants a Flintstones vitamin. So 2 or 3 Flintstones is equivalent to taking some of these. So I just tell them to take the Flintstones.
Is it? Yeah.
So Flintstones work as well. Plus they're cute. So
the iron one though, right? Sorry.
The iron one, yeah. So you get to decide if you're having Fred or Barney or Wilma or Bam Bam or whatever. And that works really well. So your go-to vitamin for our fertility population is this one?
Yeah, so for those that we usually see here, they've been trying for a while, then yeah,
use the best.
That's usually that one.
So that's the NFH product, the Prenatal SAP. I think I tend to kind of automatically go with Pregvit, but maybe after this we'll start using more of this NFH product. And we'll have to see if NFH can do something to bring the price a little bit lower because although this is more expensive, our patients are getting it covered. So maybe we can chat with them and talk to them about the fact that we'll support them, but they have to drop their price for our patients. So we'll reach out to them and see if that's possible.
And the other nice thing, just one last thing, with this one, it's nice because they separate the calcium and the iron, whereas none of the other ones do.
None of the other ones do, yeah. Awesome. Well, thank you, Jen. Appreciate you hanging out tonight with us and bringing us all the info on this. So we're going to go to the question part. Tarek is going to read the questions off the phone sideways because I can't read them from my computer on the other one. So the Instagram I can't see here. But I did have some questions from people that were asking earlier. So maybe I can bring up those for now and we can go over those ones. Is that okay?
Yeah.
So one is thoughts on tamoxifen instead of letrozole for FET prep. I have been prescribed tamoxifen for a thin lining. I hear you comment on the benefits of letrozole. Just wondering how tamoxifen compares. So I've only actually used tamoxifen once, and that's recently to see if it would help because we had tried everything else and we could not get this young lady's lining to thicken. It didn't seem to make much of a difference. Tamoxifen is a drug that's used for breast cancer, much like letrozole, but letrozole is fairly neutral in the uterus, whereas tamoxifen actually can cause endometrial cancer in the uterus because it really can thicken your lining. So some people have used it to try and benefit in that regard. It's hard to do so if you are going to keep going with it. It might make sense, but probably not for just 5 or 10 days worth. So it's probably a drug you would need to use kind of long term to try and thicken that lining. It does have risks of blood clots used long term, and you can't go on forever because that can cause a problem. So hopefully that answers that question. Let's take some questions from Facebook. Valerie. 28.7 was my last vitamin D lab work reading. I've been taking 10,000 units of vitamin D3 daily for a long time now. Wow, 10,000 units. Along with my prenatal, I am currently 29 weeks, 3 days pregnant. Is there a reason why my vitamin D level is barely staying in the acceptable range? Jen?
So vitamin D is a fat-soluble vitamin, so it's recommended to take it with foods that have fats in them. So taking it with like nut butter, like toasted nut butter or avocados might help with absorption. But that's a lot to take for a long period of time.
The 10,000? I've never heard of anyone taking that much. Although we do use the 50,000 once a week.
Oh, oral, yeah.
Yeah, there's an oral and you can also do an injection. So Val, if your level is that low, I'd probably say switch to the injectable version to see if your absorption is better. Some people do have a very difficult time absorbing vitamin D. The alternative would be to try taking it with something that has healthy fats in it, like nuts or avocado. I think bananas have some natural fats in them as well. So there's some various foods you can get that have that. What's next? What would you recommend for women who are diagnosed with ITP, that's Idiopathic Thrombocytopenic Purpura, on how to maintain a healthy pregnancy and to ensure baby is safe and not pass terrible platelets? Do you want to tackle that one? I was going to turf that one to you. Okay, so ITP does not normally impact baby that much unless your platelets drop so low that you can't clot. The only time baby gets affected is if you have antibodies to your platelets. Having said that, it can become a problem at delivery where you may be excluded from getting an epidural or a spinal. They may need to put you to sleep. You may experience more bleeding. So I don't know about a naturopathic approach to it. I know from the medical approach on our side, traditional Western medicine, we tend to use steroids in most circumstances to stabilize your platelets when you have ITP, and then in really severe cases we use something called IVIG, which is intravenous immune globulin, and that can help bring your levels up. We don't tend to do it till you get kind of close to delivery where it's more of an issue. Unless you're bruising or bleeding earlier in the pregnancy. But again, it's generally not a problem. What do you guys approach this at all in naturopathic medicine?
I haven't, to be honest, I haven't had a patient with ITP, so I wouldn't even know.
Not your...
I'd have to look that one up.
Okay, no problem. That's a you question. Does the prenatal need to be taken at the same time every day?
Ideally, it doesn't have to. Ideally, it would. So, although with this one, 3 a day, so you do morning, noon, and night. PregVit, there's 2 in there that they have to be ideally separated. You want the iron away from the calcium, so one's morning, one's night. The rest of them are 1 a day. I don't think it's a really big deal to take it at exactly the same time every day. I think it's best to help you remember to take it, to do it every time or same time every day, but like absorption wise, no.
Do you want to see if there's questions on IG that you want to ask us, Tara?
All right, just answer this one and then I'll flip over.
Is it okay to take a multivitamin while taking CoQ10 and Myo-Inositol?
Yeah, absolutely.
Yeah, absolutely. Yeah, for sure.
All right, sideways reading.
We've got, so you guys can't see Tara because he's off screen, but he's literally tilted this way so that he can read our questions off of his phone on Instagram. Yeah.
First question, can you ever take 2 prenatals?
So I recommend 2 when you have twins because you do need more.
Yeah.
Yeah, twins has a much higher requirement. So keep in mind, guys, that babies are very effective parasites and they are sucking everything out of you. So you do need a lot more vitamins when you have 2 babies there. They're very cute parasites, but they are parasites. I don't know, what do you ever recommend?
2.
Or is there too much at some point?
Like 2 different ones, I think, is the question, or?
Yeah, so normally if patients are taking PregVit, I'll just
Yeah.
recommend they take a Materna because it doesn't
As
have
well.
that much of everything. For twins, I guess you'd have to be careful taking 2 Progestia because of the vitamin A
Yeah.
content, because this has 5,000 units and your max is 10. So you got to be cautious with that one, but the rest of them are pretty
Otherwise,
safe.
there's no risk. Yeah, plus the iodine might be an
It's
issue
pretty
in that
high.
one too. But
So maybe
otherwise
don't try
they're okay.
2 of these, but the rest of them would probably be fine
Yeah.
to take 2. You wouldn't double your PregVit though. That would be a huge dose of folic acid. You don't need that much, and there are studies that show that your autism risk increases hugely. It's a 17-fold risk if you have very, very high levels of folic acid. It has to be well above taking 2 of these, but I just wouldn't risk it, and it's not necessary. The only people that need more folic acid than what's in a PregVit Folic 5 are smokers, and you shouldn't be smoking. So that's, yeah. Next question.